The hamstrings have two medial muscles, the semitendinosus and semimembranosus, as well as the lateral biceps femoris. Common injury here is going to be hamstring tendonitis. The tendons are a connective tissue that attach the muscle to the knee, the pelvis, and as well as the shin bones. When hamstring tendons are overused or misused, tiny tears can occur, which leads to inflammation. This can manifest in stiffness around the joint and pain in the muscles. So when you are going in to treat, it's good to test out the biceps femoris and the two medial muscles to see where this is occurring and to give you an idea of where you want to go, whether it be the knee, the pelvis, or into the shin bone. Tight or inflamed hamstring tendons can actually lead to pain in the knee, the buttocks, the pelvis, and even into the lower back. The sacrotuberous ligament, which can become overstressed with aggressive sport and physical activity, which can actually lead to the arching of the spine, pelvic pain, and pain that is referred down the back of the leg. All right, let's get into the hands-on techniques for the hamstrings. So for the hamstrings, because they are such a large muscle, I'll get the client to bring their leg up, and this is a nice way to stretch it, is I'll get him to press up into my hand, activating the hamstring. So Jeremy, I'm gonna get you to push up into my hand with your foot, and you're activating this muscle as you do that. And once again, we're following the protocol of contracting for 10 seconds, then relaxing for 5 to 10 seconds. And then after that, I'll place my fist down and I'll move his leg down as I stretch up the muscle belly. You're doing reciprocal inhibition. You're getting the muscle to fire, relax, and then you're manually putting them into the stretch, which just works a lot better than if they were to static stretch by themselves. Continuing on with the connective tissue techniques, here's one that I really like, and it's actually an osteopathic technique. It's called strain counterstrain. So you're bringing the tissue into the direction of ease. So right now I'm bringing his leg up, and what we have here is the semitendinosus and semimembranosus. So you've got all the hamstrings, but a nice thing to do is to get really specific. So you get in between the two muscle bellies. And I like to take my fingertips like this, and basically you're just kind of working out, easing, kind of carving, you could say scraping around in the area, although that's not a very nice term. And you're just breaking up all of the little specific adhesions and creating space between the different hamstring muscles. This is one that I really like. And I find when you're dealing with athletes, everything just gets bound and stuck together. So to do these types of techniques is really nice and helps to create space. These kind of active style releases, we can't say active release because that is trademarked by chiropractors. But for this, you get the client to bring their leg up, and then you can take your fists, and Jeremy's really tight right here. But what I'm gonna get you to do, Jeremy, is to slowly bring your leg down. And then as he brings his leg down, I'm stretching up the entirety of the hamstring muscle on both sides and getting a nice broad contact and just stretching everything out right up into the ischial tuberosity. And once again, I'll get you to bring it back. I like doing these techniques because it gives the client some semblance of control, and they're kind of directing how much pressure they want by how they move their leg. And you're going right up into the attachment point at the ischial tuberosity. Now that we've shown techniques for all around the hamstring, a nice GTO or Golgi tendon organ release at the ischial tuberosity is one that is kind of a classic maneuver, but it feels really good. So I like to take the flat of my arm here, and you're just locating kind of under the gluteal fold in the ischial tuberosity right about here. And you're just pressing down. So with this, you're placing a bit of pressure. You're using your body weight to go down into the ischial tuberosity, into the hamstring tendon, and you're pressing down on the tendon with a little bit of pressure, and you're kind of working with his breath. Right now I can feel him breathing into the area. And typically what happens before it releases is a little bit of a spasming. So as you hold it around the 90-second mark, that's when you'll feel a little bit of spasming happening. And what's really cool about this technique is that the client, as that's happening, it's going to feel a little bit strange. But after that happens, the muscle belly will actually relax, and it's one of the most fantastic feelings for the hamstrings. I think the most interesting thing about the hamstrings is actually the sacrotuberous ligament and its relation to pain down the leg, which could be sciatica or SI joint dysfunction. But treating the sacrotuberous ligament is something that's also good for pelvic pain if any of the athletes have that as well. So with that one, it can be a little bit contentious, so you definitely want to talk your client through this. But basically, it's kind of on the inner part of the glutes. And what you're going to do is kind of find it with two fingertips, and you'll curl in. And it's a really, really sensitive area. So as you're doing this, you can just kind of like carve around the muscle, but it's basically in around the glute, and then you hook in this area right here. And you just kind of like scrape or just like comb out the tissue in that area. And this can help to relieve a lot of pain down the hamstring or even sciatica-like symptoms. I'll just show you guys from the other side here. So essentially glutes, you're just kind of like curling in, and you're gonna know you're there by, there's just like this little nodule, you can feel the tendon, and especially on athletes, it's gonna be especially present. And you're just kind of combing out in that area. You can even just hold it and wait for a release. And these types of areas like ligaments, tendons, they're things that can be overlooked in massage therapy, but they're definitely things that you want to treat and look at because they're oftentimes part of the problem with whatever is going on with the person. So as much as we like to work broad and get into those areas, we also need to look at things specifically. One thing that is really important is to treat around the greater trochanter. So this is the attachment site for a lot of different muscles in the glutes, down the leg. A lot of people who have this kind of IT band pain, as they call it, that could be true, and there could be pain emanating from this area. But as a manual therapist, working down this area, it's so strong, you can't really do too much. So you need to work around it. And what I like to do is get in the greater trochanter, and I'll take my fingertips on one side, my thumb on the other, and you're spreading the tissue out in that area and creating space so that attachment site for all those different glute muscles and for the muscles down the leg, it will just give it some space to breathe and increase mobility and range of motion. And I like to start in this sideline position because it allows for that more, like I've talked about before, the strain counter strain technique of kind of easing the tissue off as opposed to if his leg was straight right now. And it also gives you the ability to create movement as you're working through the muscle. So here I'm going to place my fingertips and work around the area when his leg is getting the muscle in this position of ease. And then as it moves on and you've worked around that area for a bit, you can get them to move their leg down and straight. So Jeremy, I'm going to get you to move your leg like that slowly. So I'll get you to bring it back like this. And as I'm working through the muscle, here you can take 2 knuckles. This is another variation on either side of the greater trochanter. And Jeremy, I'm going to get you to move your leg slowly down as I stretch out around the muscle. I'll get you to bring it back. And it's nice to just do a couple passes of this just to get a nice stretch. And you can move down to different angles. You can go a little lower down into the lateral side of the hamstring and the quad. And you're stretching out just down along the sides of those muscles. And you can even do these nice little spreading techniques. And I like to do this with just, a little bit of fascial cream, just a tiny bit of oil. You don't want too much glide. You actually want to get a good grip on the tissue so that you're easing and hydrating everything around the IT band. And I guarantee you that if you do this, they're going to get relief in this area.
With the quads, athletes will oftentimes have a tracking issue and the knee will be pulled laterally. So it's important to consider the vastus lateralis and treat that. But also as you move up the outer leg to treat the greater trochanter, which is the attachment site of so many muscles. And it's also important to make that distinction between the tautness in the quads and the psoas.
Next stop is the quads. Okay, Jeremy, so I'm going to get you to kind of come to the side of the table here. What I like to do with the quads is I'll place a pillow just underneath the muscle. This one's a little bit large, but we're kind of working with what we got. And this is nice too for muscle energy techniques. So right now, here's his lower leg. I'm going to get him to push up into my hand. And once again, 10 seconds, relax. Bring the muscle down, let him rest, and then after that, you can take 2 fists and anchor his lower leg with your leg to keep him on the table. And then you're just pressing up and stretching out the tissue all throughout the quad. So as you guys can see, I'm pinning his leg up against the table comfortably. And as I'm doing that, after that, I'm working down the entirety of the quadriceps. Another nice technique in this position is that you can take your forearm, place your body weight down, and then you're just sliding up the quad until you get to the attachment site around here. While we're here, I'm going to talk about treating the knee. I find with the knee, I like to look at kind of other areas and treat around it. There's not too much you can do on here. I know there are some osteopathic techniques that kind of like you work on the fat pad of the knee, and there's also MLD techniques, which I'm more inclined to use in this area. So you're just kind of going over and just kind of spreading out, increasing lymphatic flow. You can go kind of over the kneecap in this area, and this can be particularly useful around the tendon here. And you can just kind of spread out and just get a little bit of release in that area. And oftentimes I will encourage kind of working around the bone, because a lot of times fascia does get adhered to bone, but with the kneecap, it's just such a sensitive area that you wouldn't want to kind of like, disturb anything or create any more inflammation. That's just my process. I know other people have a different way of doing it, but it's worked for me in all the years that I've been treating.
As I'm sure a lot of you guys know, working with athletes definitely is not the easiest thing. And if you want to have a prolonged career working with them, you're going to need some tools. For me, this massage gun and this fascial tool are the two that I prefer. I think this does a nice job of doing stimulation and some relaxation